Mystery on how to read your blood pressure and know your numbers. To keep our heart well-being, we should focus on the upkeep of the typical circulatory strain, as it might incite a coronary illness or stroke. Thus, keeping control of it is fundamentally significant. To know the circumstance, you need to check your numbers in any event once in a while. Be that as it may, how might you know whether your numbers are acceptable or not? Also, for what reason is it so important to know them by any stretch of the imagination? We should see. How are the pulse files unraveled? Our blood vessel pressure perusing comprises of two numbers, systolic pressing factor and diastolic pressing factor. The first is the pressing factor in your veins right when a heart pushes out the blood, while the last number is the pressing factor in your courses in the stretches between the heart thumps, at the time of rest. Norm or hypertension, how might you know? For diagnosing hypertension, there is no compelling reason to breeze through any assessments, as circulatory strain is estimated with the assistance of sphygmomanometer, an exceptional gadget, which is not difficult to utilize even at home. With its assistance, you will have the option to screen your pulse without going to the specialists. To comprehend the significance of circulatory strain readings that you'll get, you need to realize what is viewed as typical and what isn't. American Heart Association separates 5 classifications of pulse. 1. Numbers, which don't surpass 120/80ths of a millimeter Hg, are viewed as typical. 2. Records from 120 to 129 mm Hg in systole and under 80 mm Hg in diastole might be deciphered as raised pulse. 3. Numbers between 130–139/80ths – 89 mm Hg signal about the main phase of hypertension. 4. The second phase of the sickness is the point at which the figures arrive at 140/90ths of a millimeter Hg or higher. 5. Circulatory strain readings more than 180/120ths of a millimeter Hg are the indication of hypertensive emergency and request prompt clinical consideration. What components advance the improvement of hypertension? Any ascent in our pulse may flag about some unacceptable way of life decisions we make. In addition, there is various different elements, which may cause hypertension. Weight. Unnecessary weight impacts the state of our veins and heart. Age. Hypertension generally influences individuals more than 60, yet the quantity of patients more than 30 or considerably more youthful is developing consistently. Alcohol utilization and smoking. Underlying ailments: coronary illness, atherosclerosis, kidney issues. How ought to be dealt with? Get your pulse back to the standard. The treatment of hypertension isn't quick. At times, you may require a deep-rooted treatment and take a few pills on the consistent schedule. Furthermore, your medical services supplier will liable to prescribe you to make way-of-life changes. Specifically, drop smoking on the off chance that you have a particularly destructive propensity. Do actual activities in any event 30 minutes every day. Make changes in your sustenance. Add new leafy foods, olive oil, lean meat, and attempt to keep away from full-fat dairy items, handled food and cheap food. Sugar-improved drinks ought to likewise be prohibited. Learn to oversee pressure. Reduce the measure of caffeine you take. Shockingly, such measures might be successful just for raised blood vessel pressure and the main phase of hypertension somewhat. On the off chance that your numbers have crossed 140/90ths of a millimeter Hg, you make certain to begin clinical treatment of hypertension.